Hello everyone, my name is Sydnee Jackson and I'm a junior biology major here at Oglethorpe. Today I'll be discussing the effect of a prescriptive drug known as metformin on a pregnancy condition called preeclampsia. So I will first discuss some background information regarding what preeclampsia is, what metformin is, and what the relevance of a mouse model is. Then we will make our way into the experiment. I will discuss the goal of the study, the approach of the study, the experimental design, and the results. And to bring it home, I will discuss the conclusions of the study and the take-home points. So what is preeclampsia? Many of you may have heard of preeclampsia. It is a condition that occurs during pregnancy. The symptoms are high blood pressure, high urine, sometimes there's some vomiting, shortness of breath, headaches, liver complications can be diagnosed later. As you can kind of see in this infographic, it lists several of the symptoms that can occur and result from preeclampsia. And the way that this is actually diagnosed and identified in pregnant individuals is both by looking at blood pressure levels and seeing if the pregnant individual's blood pressure is higher than 140/90, as you can see here, and also looking at protein levels in the urine. The reason why protein levels in the urine are actually very bad is because it can put the pregnant individual at greater risk for kidney damage. As it turns out, when you have high protein levels in your urine, that is being processed by your kidneys, and your kidneys are not built for such large amounts of protein. So ultimately, if this condition is not treated, it can be life-threatening. For example, if the high blood pressure rises, that can cause brain injuries, blood clotting problems, seizures, and those are obviously very important factors and very life-threatening. So it's important to control preeclampsia. Preeclampsia accounts for a lot of premature births, about 15% in the United States. It can cause a condition known as HELLP syndrome, which is a disorder of the liver and blood, and if left untreated, can actually be fatal. There are a variety of things that can predispose an individual to preeclampsia. One of those things is increased BMI, also known as obesity, which is actually one of the main focuses of the study that I'm going to discuss later. So with that being said, it turns out that those pregnant individuals who are most likely to develop preeclampsia are usually between the ages of 18 and 35. They can suffer from obesity. If they are a particular race, such as Black, they can have a greater risk of developing preeclampsia. If they have a family history of people that have suffered from preeclampsia, they could be at a greater risk. And so now in terms of prevalence, this happens between 2 and 8% of pregnancies around the world, which isn't necessarily considered rare. It may seem like it's rare because the numbers are lower, 2 and 8%. But if you think about it, 5% of our bioseminar class is actually one individual. So that means that one of our classmates are going to go through this. So it's very important to understand what preeclampsia is and how we can treat it. One other thing that I want to touch on is that Black women are also at higher risk of development of preeclampsia than other races. This could be due to access to medical treatment, or diet could play a role in it. Because as in poor environments, fast food is all that is accessible most times. And so this is very topical for right now in our world, as everyone is becoming more aware of the inequality in the United States and in the healthcare system. So what is metformin? So first, metformin is a prescription drug which is usually used to treat high blood pressure and high sugar levels. It is usually used to help treat patients with type 2 diabetes. It is associated with preventing kidney damage and decreasing the amount of sugar the liver makes. And I think this is important to note because preeclampsia is characterized by high blood pressure, but also damage to an organ, specifically the liver or kidney. So this drug is known to be associated with treating those types of organs. Also, metformin helps to decrease insulin resistance in the body. You want insulin in your body, and if you do not have enough, that can actually cause diabetes and other health-related issues because cells in your body cannot use glucose for fuel, and that can actually cause them to break down. So metformin is usually used to treat high blood sugar levels, right? But it's also associated with a lower risk of pregnancy-induced hypertension, which is another word for high blood pressure, and preeclampsia. And so that's kind of what we're going to touch on in the study in a little bit. So the relevance of a mouse model. The study that I'll be discussing will determine the effects of metformin on preeclampsia using a preeclampsia-like mouse model. And so mouse models are important because they're very similar to humans in that they resemble humans anatomically, physiologically, and genetically. So we are able to make a lot of connections using them. Mice can be important in discovering drugs like metformin, and so they can be used on humans and be helpful in determining if the new medicines are effective and safe enough for human usage. And so, as you know, mice are very small, which is always important in any study, right? To have a small model organism, right? They're easy to maintain. They have a short life cycle, which makes it easier to study any effects faster. And they are easy to breed, so there can be greater sample sizes. And so mouse models are used to help us understand the cause and progress of human diseases like preeclampsia. So the goal of the study. So the purpose of this study is to determine the effect of metformin on preeclampsia. And previous work indicates that metformin is actually associated with a lower risk of pregnancy-caused high blood pressure levels and preeclampsia. But we don't know the exact pregnancy outcomes. So we know metformin means less preeclampsia, but that's only a correlation. So they wanted to know the exact outcomes in this study. The experimental question of the study was, how does metformin affect preeclampsia? And so the prediction of the study is that metformin will actually play an important role in improving the development of the placenta in preeclamptic mice, which will improve the symptoms of preeclampsia and pregnancy outcomes. And so from that prediction, it's saying improve the development of the placenta. So we want the placenta to be big enough to be able to support the fetus, right? And we also want the fetus to be big enough so we know it's healthy and it is using all of its nutrients, right? So keep that in mind when we go through this study. So the experimental design. So the scientists first started with 38 4-week-old CD1 mice. And so what a CD1 mice is it's an outbred albino Swiss mice that's used as a model to research toxicology and immunology. And so because of their lineages, they are known to have low genetic abnormalities. So that's honestly perfect for a study. You don't want to have any genetic abnormalities, because that can alter the results of your study, and we want those to be clear and precise. So these 38 female 4-week-old CD1 mice were randomly separated into a high-fat group, which you see here. And that high-fat group had about 62% of fat in its diet, right? And there was 25 of them. And then it also was split into a control group, which was fed an isocaloric diet, which is mostly an even, healthy diet, and there were 13 of them. And so the diet started 6 weeks prior to pregnancy to predispose the mice to preeclampsia, so that they could have that preeclampsia-like state. And so after 6 weeks, the mice were weighed and mated. And so females were checked for post-copulatory plugs, which signify the half day of pregnancy. And so even when I was looking at the study, I had no idea what a post-copulatory plug is. So a post-copulatory plug is also known as a mating plug or sperm plug, and it pretty much is the part of the male genitalia that is deposited into the female genital tract after mating, and like earlier stated, it signifies the half day of pregnancy. And so they would look at this plug daily. And so at the half day of pregnancy, the high-fat diet group was randomly divided into a high-fat group, which you can see here, and a high-fat with metformin group right here at the half day. And so the high-fat with metformin group was actually given 20 milligrams per kilogram of metformin daily, and there were dependent variables that were then measured, which included maternal blood pressure, maternal urinary protein levels, right? The maternal and fetal and placental weights were measured after they were removed from the mother, and the placental structure was analyzed. So before kind of getting into the results of the study, if metformin were to, improve those dependent variables, right, you'd want the maternal blood pressure to decrease, right? You would want the maternal urinary protein levels to decrease. You'd want the maternal, fetal, and placental weights or the fetal and placental weights to increase. And so you want the placental structure to be rather big, because you want those nutrients for the fetus. And so diastolic blood pressure was measured, and although the image is a little bit blurry because the image was originally blurry in the study, I kind of included some shapes on the side that go along with the key. So the triangle represents the high fat with metformin group, the square represents the high fat group, and the circle represents the control. And so here, if you follow these lines, you can see that the top group represents that high fat diet fed mice group. The middle line represents the high fat with metformin group, and the bottom line represents that control group that was fed that isocaloric diet. And so the diastolic blood pressure in high fat with metformin group, which is that middle group, began to decrease on day 12 compared to the high fat group. So you can see that the high fat with metformin group is actually lower than this high fat group here. And so you can tell that metformin did improve blood pressure levels. And so the blood pressure in the high fat group was significantly elevated compared to those control groups and that high fat with metformin group. So yes, metformin in this case did improve blood pressure levels in the high fat with metformin group. So good news. Okay, so next, urinary protein levels were analyzed. And so, as you can see here, the y-axis represents these urinary protein levels, and the x-axis just kind of touches on which groups we're looking at. And so you can see this represents the control group here. This group in the middle represents the high-fat group. And this one represents the high-fat with metformin group, right? And so the urinary protein levels in the high-fat group were significantly elevated compared to those in the control and high-fat with metformin group. So you can see that these squares are way above these circles in the control and these triangles in the high-fat with metformin group. And so you're able to deduct from this information that metformin actually improved urinary protein levels in the high-fat with metformin group because you want those urinary protein levels to be low because, as we stated earlier, the kidney is not built to have high levels of protein in the urine. It's a filter. It does not want those high levels because that can be causative for kidney damage. So as you can see, metformin did play a role in that. Okay, next. So we're analyzing placenta here, and so on the left side we have just the placental weight on the y-axis, and on the x-axis we have the groups that we're looking at. So in this first category we have the control placental weight. In the middle category we have the high-fat diet group's placental weight, and then in the high-fat with metformin group, it's all the way to the right, the placental weight. And so, as some of you may know, preeclampsia actually originates from abnormal placental development. So we want placental development to increase. We want the placenta to be big. We want it to give nutrients to the baby. And so the placental weight of the high-fat group was lower than the control group. So you can see here, these circles are a lot higher than this high-fat group, right? And so the placental weight of the high-fat with metformin group actually increased a little bit compared to the high-fat group. The triangles are a little bit higher than this high-fat group. And so we actually also see the same pattern with the fetal weight. The fetal weights of the high-fat group of preeclamptic mice were actually significantly lower than those in the control group. So fetal development was delayed. It showed similar patterns to the placental weight. And so the fetal weight in the high-fat with metformin group actually increased significantly compared to the high-fat group. The weight of the newborn is obviously important because it shows the growth and nutritional status. So it's nice to know that the metformin did actually improve that fetal weight and the placental weight in this case. And so let's take a look at the right side of the slide. And so placental development is obviously important. And so the placental structure was analyzed via a staining of placental tissues. And the results demonstrated that the area of the placenta of the high-fat group was actually reduced compared to the control group. So if you can kind of see here by looking at kind of like the outer lines of these rectangles, you can see that the control group is honestly touching this outer line and is pretty close to touching this other line. But if you pay attention to the high-fat group, it's more towards the middle, honestly, and so we're able to tell that the area of the placenta of the high-fat group is a lot smaller than the control group. And so the high-fat with metformin group's placenta actually had a greater area. It kind of resembles the control group in a way where it's kind of pushed out to these outer limits of this rectangle, but in comparison to the high fat group, the high fat group's a lot smaller, has a lot smaller area than the high fat with metformin group. And so you're able to deduct from this information that metformin can improve development and growth of the placenta, which is great to know. So the take-home points, very important things. So preeclampsia, like earlier stated, is a pregnancy condition that is characterized by blood pressure and high protein levels in the urine, which were analyzed in the study that we discussed. And so metformin is used to treat high blood sugar levels, but it's actually associated with pregnancy outcomes. And so metformin improves pre-eclamptic symptoms and pregnancy outcomes in a mouse model, right? And so with that mouse model, we saw that they were some of the mice were fed a high-fat diet for 6 weeks to kind of emulate that pre-eclamptic state. And so from that, with the high fat with metformin group, you're able to see that the high blood pressure levels actually decreased, right? The proteinuria, which is the protein in the urine that's very bad for you, right? Decreased when metformin was used. The placental weight for the high fat with metformin group increased, which is important because we want that placenta to be big and supportive, right, for the fetus. And then we also saw with the high fat with metformin group that the fetal birth weight also increased as well. And so that's also important because we know that the fetus is receiving the nutrition that they need. And so kind of the final thought is that one can prevent preeclampsia, obviously, by having a healthier diet first. Because as we saw with the high fat group and that obesity factor, right? High blood pressure was high, proteinuria was high, placental weight was down, fetal birth weight was down. And so exercise can also help with that, right? Rest can help with that, but also a prescribed medication by the doctor. And so that could actually be metformin for some people. And so I just think that it's important to discuss what preeclampsia is and to educate everyone on what preeclampsia is. And hopefully you learned something from this presentation. I know that I did. And so hopefully you can share this information with the next person and the next person, and then everyone will be educated on what preeclampsia is and how important it is to know the effects of preeclampsia for pregnant individuals. So thank you for listening to my presentation, and I hope you have a great day.